The time right now is 6:11. Inflammatory bowel disease targets your digestive system. In this week's Ask the Expert, I sat down with a doctor who specializes in the chronic condition to learn more about how to receive a proper diagnosis and treatment plan.
There are two types of inflammatory bowel disease, or IBD: ulcerative colitis and Crohn's.
Crohn's disease can affect anywhere from mouth to the rectum. However, ulcerative colitis only affects the colon part.
That's Dr. Furkan Ertem. He's the inflammatory bowel director with Bon Secours St. Francis.
Both can present as gas, bloating, belly discomfort, and then sometimes change in appetite, not feeling well.
Both types of IBD cause swelling and inflammation of the tissues in the digestive tract. Other symptoms might include unexplained weight loss, low blood counts, or anemia.
And then blood in the stool that is consistently, it's not only one or twice.
Dr. Ertem says the gold standard for diagnosing is an endoscopy or colonoscopy for direct visualization. So what causes IBD?
Studies suggest that in Western world, we have more prevalence of the IBD compared to Eastern world. That we have some hypotheses for that. One is, and IBD is more common in countries have more sanitation or better sanitation.
He says the other hypothesis is directly related to diet.
If we see more Western type of food intake, more fast food, that we have seen increase on rate of IBD.
Dr. Ertem says modern medicine makes treating IBD easier.
At this point, and now we have a group of drugs called biologics. These group of drugs, there are powerful drugs that affect specific targets for Crohn's and ulcerative colitis,
which allows patients to lead a close to normal lifestyle. That can also be achieved through the foods we eat.
There are studies with Mediterranean type of diet that shows that if people follow Mediterranean diet, their symptoms improve with IBD.
And no smoking.
Especially in Crohn's disease patients, smoking definitely makes it worse. Sometimes it prohibits our drugs working.
If you or someone you know might be experiencing these symptoms, it's best to seek medical advice from your doctor for possible treatment options.
Dr. Ertem says that it's important to act because if IBD goes untreated, it could possibly lead to cancerous risks. To submit a question for our Ask the Expert series, head to our website, WSPA.com.